Hi there, my name is Hope. I'm a student at the Graduate College of Social Work at the University of Houston, and I'm here today to present a policy proposal to encourage culturally sensitive mental health reform in Washington state jails. So the social problem at hand is that Indigenous individuals in Washington state jails are dying at a disproportionate rate to their white counterparts. And that's a big problem. And to begin, I want to start with the fact that the majority of those deaths in Washington state jails are suicide deaths, death by suicide. And but that being said, Indigenous individuals nationally and in Washington state have a higher suicide rate. So when they come into jails, they're already at higher risk for suicide. And then the stress of being brought into jail and not being with family, not really knowing what's going on, puts them in an even more vulnerable state than they already are. And so jails are not equipped to handle this problem, especially because Washington state jails don't have any culturally sensitive mental health screening and substance use screenings mandated or put in place in their jails. And there isn't a lot of training around the way that Indigenous individuals in our communities understand mental health. And in Indigenous culture, the understanding of mental health is a lot more holistic. Body and mind are very intertwined, and oftentimes Indigenous individuals do not see they don't see mental health as an illness. They don't even really have, not all, I'm not generalizing, but many don't have a conceptualization for mental health or mental illness in the same way that we do. Their symptoms may be more likely to feel them as somatic symptoms, feeling sick, things like that. And so that's why it's important for jails to be aware of these things. And if the people in the booking staff don't have a conceptualization of these things, then they aren't able to help in the way that maybe they should be. And so the policy problem here is that there's a lack of funding for mental health services in Washington state jails. The truth of the matter is many Washington state jails are extremely understaffed, and they're not giving adequate mental health and substance use screenings, especially for minorities, in a way that works well for them. So what the proposed bill would do would be amending the engrossed substitute Senate Bill 6032, which is currently providing mental health funding to Washington state jails. This would be renewed with an amendment to add more funding, because what we're finding is that the behavioral health organizations that are providing these services are reporting that they don't have enough funds to adequately provide them. And right now, there are no stipulations on how these funds need to be used, but in the proposed bill, there would be some mandates around how the funds need to be used. And first off, the funds need to be used to increase staff. A lot of the jails, like I said, are understaffed, and so the first step is to get them staffed, to get people in there, because an understaffed jail is not a safe jail. Additionally, funds need to be used to provide training to booking and mental health staff in culturally sensitive practice with minorities. And thirdly, there will be annual jail inspections to ensure the health and safety of all of those residing in Washington state jails. And in addition, all of the funding, all the jails need to report how they're using the funding given in this policy. And the intended impact of this bill is to reduce the number of Indigenous deaths in Washington state jails, especially ones caused by mental illness and suicide. And a study done by Severson and Duclos suggests that implementing culturally sensitive assessments can lead to a better understanding of these individuals' mental state and provide preventative measures to be put in place to prevent suicide in these individuals, which I believe supports this policy proposal. So that's what I have for you guys. I hope that you'll support this proposal, and thank you so much.